All right, so now we're going to move into some infections of the eye. Some eye infections are going to be very common, pink eye, for example, and some are going to be very rare and often not in our country, but maybe imported from other countries. So just keep in mind that the eye is very protected from your immune system. It's a privileged site. And so an infection of the eye can be very, very dangerous because now you are bringing in your immune system when normally you would want to keep them out. You don't want the immune system to damage your eye. The eye infections are going to be very painful, and there's always going to be a potential loss of vision. And typically, if you had an infection in one eye and your immune system moves in and causes blindness in that eye, oftentimes your immune system will attack the other eye and you will lose sight in the other eye as well. Conjunctivitis or pink eye is the most common. There's also infections associated with contact lenses if they're not appropriately cleaned. So one is keratitis, so you can get lens keratitis. Pseudomonas aeruginosa is going to be an active keratitis, usually occurs nosecomally in the hospital. Other parts of the eye are also going to be infected. Cornea is going to be a keratitis. You can have your orbital sinuses, which can be more severe. Okay, so with respect to infections, we have our bacterial causes and our parasitic causes listed here. So our bacterial causes are for our neonatal, which we'll have a talk about, is Neisseria gonorrhea. So this is a very severe infection for neonates, and this is one of the reasons why when children are born in the developing countries, they are given antibiotic eye treatments immediately. And that's because a woman who has Neisseria gonorrhea may pass this on as the child's being born through the birth canal. Now, there's also going to be conjunctivitis, and this can have several different bacteria species, including our normal floras, staph and streps. We have trachoma, which is chlamydia trachomonas, and this is going to be an infection that can cause blindness and lead to blindness. And keratitis can be caused by a number of different sources. This can lead to ulceration, and this is mostly associated with immunodeficient or patients that are debilitated in some way in long-term care facilities or in the hospitals. Now, the parasitic ones are a little bit more, are going to be very rare and also be associated with a certain location. We have Onchorosa volvulus, which is going to be transmitted by black flies. So in areas where the black flies are prevalent, you can get this. This will transmit what's called a microflaria, and the microflaria will be able to migrate through the body and finally find its way to your eye. Loa loa is another type of a worm, and this is going to be transmitted by the deer fly, and it's going to be causing conjunctivitis and in your infection in your cornea. And we'll show you a picture, and you can actually see this worm in the eye itself. And then, of course, acanthamoeba was associated with contact lenses because people would use unsanitary conditions to clean their contact lenses. This is an amoeba, and it can cause a lethal brain infection. So infections of the eye or trachoma is the leading cause in underdeveloped countries. And so this is going to be spread to the eyes by your hands or through a fly biting. This can lead to scarring and vision loss. Onchorosa volvulus is going to be the cause of river blindness. And this is going to be spread by our black fly. And this actually transmits the parasite into the eye. The parasite will then cause ulceration, fibrosis, and ultimately blinding of the person who is infected. Loa loa is going to be a parasite, the worm that gets in there. This is transmitted by the deer fly. This is going to be associated with the African rainforest. And the worm is going to migrate to the mouth of the fly and be transmitted when it's bit. It has a microflaria form that migrates through our tissues. So it's similar to a life cycle like a hookworm, except for Loa loa wants to get to your eye, not to your gut. And so it's going to find its way through the subcutaneous tissues. It's going to settle in the cornea, and the worms can grow to more than 1 inch in length, and you can see it actually in your cornea. And then finally, important for developing countries as well as countries developed is neonatal gonorrhea eye infections. And this is serious eye infections that are going to be contracted as the infant passes through the birth canal. Chlamydia trichomonas can also infect the eyes, but both either chlamydia trichomonas or your Neisseria gonorrhea are going to cause a large amount of pus to form on the eyes. This will cause ulceration and scarring of the cornea if not treated. And so those erythromycin droplets are usually put in the eyes right after the child is born.